Yeah. Okay, so we started recording because we also post this on our website just for folks who are unable to attend. Okay, so I was going to give a disclaimer. I am not a user experience designer, not by any chance. I just took a few courses over a few years. But I've got designers in the room, so I'm excited to have them talk with you about user-centered design. What I am is an implementation scientist and researcher who focuses on the experience of users of the public who need access to public health services that leverage digital technologies. It's important to state that all that we're talking about today in terms of human-centered design, design thinking, is applicable to public health in general. Obviously, we're focusing on digital technologies here, but I think that the methods, the skills that you gain here, you can also apply to other public health problems. So I would say that that's exciting. So what are we doing today? We have 4 blocks of activities to do. First, we will talk about the basics of design thinking. So I've got Sol, who's a UX designer, a product designer, who will talk and walk you through the steps of design thinking and what that looks like. We will learn from a real public health problem, one that I worked on as part of my doctoral dissertation. Again, this is a low stakes activity. I know when we talk about activities or group activities, people get worried about, being shown off. Nah, it's very low stakes, fun activity that should help you understand some of the principles behind design thinking. And then we're happy to have Heather Pedersen and Mark Bondyra, who've done a lot of work over the years on Get Checked Online, which is a program they were introduced by themselves, but a program that has significant public health impact. And they were showing us some of the tips and tricks they have used and learned over time in applying design thinking in public health. And then finally, we'll wrap up with another activity in the room. I know that we've got now about 20 people online and then someone in the room. So we'll try and figure out how to make these activities engaging for those online and those in the room. So before we start, does anyone, if you can get your phones and just scan the QR code, I just want to learn from you. So, have you ever used design thinking before? Have you ever been involved with a project that used design thinking? If you can scan the codes or the QR codes online using your phones, or just go to slido.com and enter the numbers, it'll be good. I see we have about 5 votes. Yes, what's design thinking? I too would have selected that option. Yeah, I see. Yeah, so I'll just give it a few more minutes. A few more seconds, sorry, not minutes. So a few people have worked with design thinking before, but the majority of us don't know what design thinking is about. So I feel a little calmer. It means that even if I mess up, nobody can know. Yeah. Okay, so we'll move on. Before we start, I'm now wondering what got you interested in coming. For those online, for those in person, if you can also go on Slido. When you think about design thinking, or when you heard about design thinking in public health, what came to your mind? You can use a few words, a phrase, just what comes to mind when you think about design thinking. You can just type it in the Slido, just a word or two in the Slido. Sorry, I should have mentioned that. User-centered design. Yeah, okay. User-centered accessibility, tailored public health interventions. Yeah. Practical and usable solutions to problem. Yeah. Intuitive digital product, purpose-built, adding tools to my toolkit. Communication. So it's very broad and varied. I don't see any big central terms coming up, which is interesting. So we have very many views on what user-centered design is, and hopefully, I wish I'd put this again at the end. Hopefully we have a similar conversation. Oh, co-design. Aha, finally something. Co-design, yeah, co-design should be something that we talk a lot about in public health. So it's interesting to see that people are mentioning it here. Okay, so I'll just start by describing what design thinking is about and how it is relevant to us in public health. And we'll start by just looking at some of the words that you have already talked about when we asked that question. Frequently, when you talk about design thinking, you will hear other words like person-centered design or human-centered design. You also hear words like user-centered design. And all of these coalesce around a central principle, an idea or a framework. So what design thinking really is sort of a framework for creative problem solving that involves understanding people, challenging the assumptions that you have, and redefining problems to identify alternative strategies and solutions. Many words to say, it is really about focusing on people and their context to create the solutions to the problems that they actually have, not the ones that you think they have. I'll say this and ask you the question, have you ever been in a room where the first thing you hear as you get into a conversation is, we should make an app? Yes, we should make an app to help people access COVID-19 vaccination. And then when we made that decision to make the app, we then walk ourselves back to figure out the problem that the app is going to solve. Design thinking goes in the other direction. It meets people where they're at and tries to understand what are the issues. Removing all of our perceptions and ideas about the problems that people face, can we ask them from their own perspective what their issues are and then figure out a practical solution to their problem? So it's sort of a philosophy. And within that philosophy, you have other tools and approaches, including things like user-centered design, which really focuses on the task. So what are things that people have to do to get to their goals, and figuring out a very intuitive way for them to actually accomplish those tasks. And then human-centered design, which is also within the context of design thinking, focuses on people and their context. How do they feel when they access your solutions or your interventions? What are the feelings like? Does the intervention account for their context? Does it make them feel, engaged with the process? So all of them really focus within that design paradigm of human-centered design or design thinking. And I will get Sol to describe it a lot better than I am doing, because I think I'm doing a stinker of a job here. But she'll do a fantastic job of really helping you understand what design thinking is about. Okay, so how am I going to make you a co-host? Can you just do that? Okay, so I'll go to the next slide. So like we said, design thinking is non-linear. It's an iterative, collaborative process that helps teams to understand people, to challenge the assumptions that they have, and to redefine problems to create solutions. But then what's the point in public health? Why is this necessary in public health? In public health, we tend to deal with complex problems. I think one of the things that got me into public health many years ago now was the idea of what we called wicked problems without one particular solution, where you have to think very deeply about what you're trying to do for people to solve their own problems. And so rather than thinking about using empirical data to find single type solutions, in public health, you work with people experiencing these problems to design multiple potential solutions. And you constantly collect data on the solutions that you're finding to adapt it to different people's contexts, knowing that different communities and different people will engage with the intervention in different ways. So for design thinking, it becomes a sort of framework for addressing complex problems with solutions that are embedded within the communities that are affected by the problems that you're hoping to solve. And so for me, that becomes a very engaging way to do public health. And that's why I actually went to take courses in human-centered design in the first place. Think of design thinking as sort of at the intersection of a number of things that you might already know in public health and think about in public health. So first off is the idea of implementation science. So when I started this conversation, I talked about my role in implementation science, where you are trying to figure out what works for whom and under what circumstances. Design thinking is a framework that can help you really achieve that. And Heather will talk a lot about the work that we've done with Get Checked Online, embedding implementation science within design thinking as a framework. But then we think about continuous quality improvement. So it's not enough to create an intervention and think that, it's a one-off thing. How do you continuously improve on the intervention to reach more people, to make sure that the solutions you have created actually address the felt needs of these people? And then finally is the idea of community-based participatory research. I hope that this is a word that's not new to people, a term not new to people, but this is working with communities to generate ideas that empower the communities to solve their own problems. Again, when we talked about design thinking as a framework for doing that, it sort of mixed or is the same language, just said in different ways, right? So it sits at the locus of these three things, and we'll describe how we have worked with different communities to actually empower these communities to actually create solutions for themselves. Finally, this is the crux of the conversation. Design thinking is an iterative process. I'm starting by saying that because this looks really neat and cyclical. It usually will be, you will see in the literature that there are 5 stages. I think Nielsen Norman added the 6th stage just to show that implementation is actually a key piece of design thinking. The iterative phases go with first empathizing with populations that you're trying to achieve solutions for. Really understanding them and their context and figuring out what the problems they experience are. And then we move on to the define stage where you then coalesce all of your findings within the empathize phase on a core problem that needs a solution. And then there's the ideate phase where you're creating a broad range of ideas that can potentially fix the problems that you identified within the define phase. And then there's the prototyping phase where you're creating more tangible versions of the ideas that you created in the ideate phase, and then testing it to see how well it works with these communities that you're hoping to achieve solutions for. And then finally, the 6th phase, which you may not see in many of the literature, the implement phase. So we never forget to implement. We're doing all of this to actually implement, and that brings the process of implementation science very clearly to us. So I'll stop here and invite Sol, a product designer who's had many years designing products within public and private services, and now is completing a master's of information at the iSchool. Mm-hmm. Let's see, I'll stop this and then try to share.
Okay, well, hi. As Eugene introduced me, my name is Sol Alban. I am a product designer, and I'm currently also a MLIS student at the Information School, BBC. And I've worked both in public and private sector. Today I'm going to be covering all of those steps that we introduced, and also sharing with you some examples of how this looks. Because when you start looking up information about design thinking, most of the time you get this really nice stock imagery of people just pasting colorful Post-its on a wall. And it looks very nice, but that's usually not how it looks in real life. So that's what I wanted to share with you today. So just as a brief review of what we've covered already, the design thinking process is a framework for innovation at its core, and its main goal is to achieve user-centric or to look for user-centric solutions to specific problems. As we are going to cover, We will be going over each phase in each of these 3 stages. So I'm not gonna mention them now because we're covering in detail. Stage 1 is understand and is comprised of 2 phases. The first one is empathizing. In here, our goal is to collect enough data so that we can empathize with our user base and their perspectives. And some of the activities that you might be undertaking here include trying to understand what your users do, say, think, and feel, and just exploring your community's unmet needs. As you can see here, some of the tools and kind of illustrate what you can do here are generally qualitative research methods around interviews, focus groups, trying to understand your user base, empathy maps. I wanted to illustrate, you can do, for example, this is a card sorting exercise where you're trying to map a user's mental model of a specific problem. And you can also do it online as we're doing this session. Most of these techniques you can also implement online. And then if you're working with an already existing product that you're trying to improve in some way or update, you can also look at quantitative data, analytics, or usage data for that specific tool. So our second phase is define. Our goal here is to define the problem our users are facing and articulate it in a way that it becomes the problem that we're going to be addressing. So some of the activities that we're going to be looking at in here include first a synthesis of our research findings from the previous phase, and then just looking for our users' unmet needs and turning this into opportunities for innovation, or basically what we're going to be trying to achieve. And at this point, we should start defining both functional and emotional requirements. In public health, I was discussing this with Muhi as a way to create equity. So some of the tools that are traditionally used at this stage include empathy maps, user personas. So we're going to be working sort of a user persona today. But this is just an illustration. This is for not public health related, but of a user persona that was pretty much just a synthesis of everything that we've collected during multiple rounds of interviews with different users. And then another tool that we use is trying to understand how that user flows through the experience. So this is just a fragment of user journey map. And you're gonna see a different version today as well, because this, it varies a lot how they look, but basically you're trying to map how your user feels and what they are doing at each stage of trying out your experience. And this includes both the online and the offline experience. So it's not just me on the website, but also how I got there and what I do in the meantime. Maybe I leave the tool for a bit and then I come back. We're trying to understand the whole. Then we move on to stage 2, which is explore. And again, very deeply divided. So it's 2 phases. First one is ideating. In here, we're trying to generate a wide range of ideas to address the problem that we've already defined. Some of the activities include sketching out as many different ideas as possible. At this stage, we're looking for pretty much quantity and trying to go as wide as possible with our ideas. And then we're also going to be sharing with a group and remixing and creating new ideas. I'm sorry. As you can see here, again, both in person, online, similar dynamics. You're going to be doing brainstorming, workshops, and it might not be super pretty. This is documentation. The one on the top is documentation on what I had done with a group. So we initially use whiteboards, and then I
pretty much just sketched it all out so that we had like a documented version of it for future reference. Then we move on to prototyping. I hope you guys can see. And our goal here is to weight in, at this point, reality matters. So we're weighting in the impact and the feasibility of the ideas, trying to take the parts that work and discard the parts that don't. And some of the activities that we're undertaking here is we are creating prototypes. I wanted to illustrate what traditionally prototypes look like when you're working on digital interfaces. So these are called wireframes, and these are pretty much sketches of how you envision the experience to look like and the different screens or the different steps that you're expecting your user base to go through. They range from very low fidelity, like the one on top, which is literally just pen and paper. And as you can see, they don't have to be super nice or super detailed. We're gonna try some prototyping today. So yeah, I'm sharing it with you. Please don't be intimidated. They can look like just stick drawings. And then we move on to higher fidelity wireframes, which are usually done on computers. And at this point, this would be probably considered mid fidelity because these don't have color or imagery, but it depends on what you're trying to achieve with the prototype. This could be okay as well. And finally, we get to our third stage, which is materializing. First, we're going to be testing our prototypes. So at this point, we're trying to determine if the solution meets our users' needs and pretty much achieves the project's goals. And so our basic activity is just collecting feedback to try to determine if we achieve what we were trying to accomplish. And some of the ways in which we can do this are traditional heuristic evaluation is what is known as, more commonly known as usability testing, where you try to get a version of a prototype in front of your users and you either give them a set of tasks and ask them to complete the tasks, or you can also be a bit more open and just let them explore and tell you like a think aloud exercise where they just tell you what they are looking in front, what's in front of them and what's going through their minds. And again, these are some examples. The first one at the top is done online. So we were testing out mid-fidelity prototypes and it was all done on Zoom. This second version, when you need to prototype and test and you have to do it really fast, you can do what's called paper prototyping, where you just print out your wireframes. And that way you don't have to go through the whole process of like inputting the prototype into a specific software and then creating the prototype. This was more popular a couple of years ago because the prototyping software has come a long way. And now it's way easier to do it online, but it can still be done this way depending on the user base and like the community that you're working with. It might be an option. And then of course, what's traditionally done is just the highest fidelity possible on a prototype that users can take in their hands, if it's an app or if it's a mobile experience on a phone, and then you give them the tasks and they try out what you're asking. And this is the sometimes not mentioned sixth phase, which is implementation. I thought it was, I find it very important based on having worked in different product development projects. Our goal here is to materialize our solution. And sometimes this is overlooked, but it's very important in the end. Some of the activities that you're taking part in at this point include just sharing design documentation, collaboration with the development team. And when I mention team, you don't necessarily have to think of like a 60-person team on the other side of the world. Most of the time, in my experience in the public sector, it looks like a 3-person team where you have one designer, one developer, maybe someone that represents like the stakeholders in this, or your user base. But still, collaboration is very important, as we're going to see in the next presentation. And part of what you're trying to share to improve that collaboration is any UX or visual requirements. You can share very high fidelity prototypes that specify like this is how it's supposed to look and this is how it's supposed to work, or a style guide or just design guidelines so that it's easier for the development team to build the solution. And just before I wrap up, I just wanted to reiterate that iteration is key here. We're gonna see how it looks in real life in a second, but if you get to a point where you're testing and everything is perfect, that usually means that you have to go back, because that's not to be expected. You should be getting feedback that tells you that you have to look to specific areas. I think I was discussing this with Muji, that if everything's perfect, maybe there is something in the methodology, because part of why we're doing this is because you're expecting like areas that are not going to necessarily work on the first try. So yeah, thank you very much.
Thank you. Oh, thank you, Sol, and thank you to the audience online. I've just been trying to look to see if there are any questions. We have a few minutes to take a few questions. I know we've thrown a bunch of information at you, quick fire, but if you have any questions, now's your chance. Okay, I see one hand here, one hand here. Do I see any hands in the audience online? Okay, yeah, Aurelia?
Yeah, I wanted to know more about the user part and how did you go about addressing potential differences that the user needs and the needs of the user base might be. Right. So related to that, just quick thing. I want to talk about design thinking for your life. And then the one thing that I took away from that was start prototyping right away. Like you don't try to spend a lot of time designing or thinking or ideating, but rather like going to prototyping and then revise it. How does that apply to this kind of process as well, or do you have to do more like the preliminary thinking, conceptualizing, and then you want to?
Right. Okay. So, well, first, so I think it's kind of different parts to your question. So to address the first part about the different users, what I shared here were actually two different users. And when you're doing on the empathize and define phases, you're usually trying to determine how many different personas you're going to be present. So I don't think I've ever been a part of a project where we only had one persona, and I would expect in public health where you have than other industries. So yeah, sorry if that was not clear there. And also with your journeys, you're trying to map out the different experiences the different users are gonna have. And then
So, can you repeat the second question?
Second part of the question.
Yeah, like as I was mentioning in this book about designing your life, like the main idea was that you jump into prototyping right away and to not spend a whole lot of time thinking about what you're going to do, but rather just jump into it. But this one, I'm seeing that there's kind of more of the preliminary setting the stage type of process. So I was wondering if like you move through that faster, or you have to spend for more kind of elaborate design thinking projects much more time on the thinking around it and then prototyping.
So one thing that might be, to clarify, one thing that might be a bit misleading about looking at a very nice part like this one is that not all phases take the same amount of time. So you might be spending one afternoon, one phase, and then 6 months implementing just regular implementation. So that's one part. And then I think I was discussing this with Muji when we were putting this together. Most of the phases bleed into each other. So it doesn't mean that you can't prototype until you get to that point. And the definition of prototyping is very broad. For some lines of, like some schools of thought might consider that what we're going to find out today is prototyping. And we're not going to be building anything. We're going to be in the ideate phase, but it's still hands-on and we're trying to get our ideas across to a group of people. And that's why some approaches to design thinking help you to start by prototyping pretty much from the get-go. They're usually referring to like very low fidelity where you're just sketching out things. So, idea.
Thank you.
Yeah. I saw your hand.
Oh, yeah.
Yeah.
So my question was, within healthcare, when we do an implementation of anything, we always have kind of a timeline to reevaluate and go back to make sure everything is working and meeting the needs of, like, I don't do technology, but I do kind of like project plans or policies. So is there kind of do you kind of continually do that? It's like the reevaluation piece?
So Mark might be more, but they might know better for the health sector. But at least in my professional experience, you do try to set times for each stage and you take into account that there is going to be iteration there. That's a constant struggle that you usually have with like project management, that you have to take into account that you might be revisiting some stuff. And at least in the tech industry, it is to be expected that you're going to be looking back at what you just launched. When you launch a product, the UX team is usually working on the next version of it.
Okay.
We kind of go like at least 2 years in advance in some projects because you already know that you're going to be reworking stuff and you're already working with users, doing interviews, kind of cut. Yes, on the first.
Okay, so it's just built in. It's like a built-in circle.
I see a few hands. So I see one hand online. Mark.
Yes, hi. This is really interesting. Can you hear me okay?
Yep.
Yes. Okay. So my question is, I think just picking up, I think you had mentioned the example of like in COVID building an app, you know, maybe then going back and thinking about design thinking. I'm just thinking like to in the context of like emergencies where, you know, digital solutions might be needed, like how rapidly can you do design thinking, like or what do you need to have in place in order to be able to do this rapidly? Yeah, I'm just trying to think practically about how you would put this place in the future.
Anyone want to take that question? I'm going to invite Mark and Heather, who have more hands-on skills than I do.
Well, we work in public health, so nothing happens rapidly.
Except COVID, except during COVID.
It's pretty rapid.
So I think that this framework is pretty flexible, and we have seen it being implemented pretty rapidly in certain contexts. The question is, what resources do you have to actually quickly move through all the phases as quickly as possible? Like Sol was trying to talk about, the ideate phase may be rapidly or maybe shortened to a few days to weeks, and then you're rapidly prototyping and moving through the phases. It's a question really of resourcing. And what we saw during COVID was that the floodgates were open, resources were made available very quickly. And so a few apps came out quite quickly. What I will say is that based on my experience evaluating some of these apps, and I'm happy to say a few places where we did that with, some of the time you do see the disadvantage of rapidly rushing through the process because, again, some of the times either the solution was not addressing a felt or a real problem that communities had. It was addressing what people felt was important at the time, but communities didn't necessarily take it up as the problem. So it's, I guess, walking the fine balance. If you have the resources, obviously it's possible, but how do you still make sure you take the time to do it well and to make sure that you're solving the right problem? And so that's why I will probably emphasize a lot. I know, just to say another disclaimer, I'm a researcher, so I really like the empathize phase. But I emphasize it because you want to be solving the real problem. And there are many things that you have to take account for in that phase. First off is that people will tell you what you want to hear if you haven't spent time and gained trust with them. And so if you talk to people very quickly, and you say you're trying to solve a problem, you probably will be hearing what you want to hear in the first few days. If you take the time to build trust and to figure out what people are really feeling, then you can start to dig, unravel those layers, and really get to the core of the problem. And to be honest, if you don't do the empathize phase well, uptake at the end of the day when you launch will show you that you didn't do it well. So the results will tell. Yeah. Any other questions?
Can I just add something to that?
Yeah.
I think the thing to remember about this is like this was made by designers for designers. So in a way, the assumption is that like a designer is coming to like a project or like a domain. Sorry, I have a bit of a cough. And so they might not know the users at all, right? But like people who are working in healthcare kind of know their users already, at least a little bit. So you're probably like already empathizing a little bit. So like Sol said, it might be like a half an hour thing that you do, or it might be one meeting where you sort of like think about that part. And then you're like, actually, we do need to build an app. But the caveat is like, maybe you're going to get it wrong. But this is just to say you probably have a lot of that empathizing already. Because you're not coming to things like fresh, like a designer would be that you're hiring or whatever.
Yeah. And I think our activity today will show you how, sometimes you are just going to stumble in on a body of work that has been happening for a long time. And so you can just leverage that to do your designs. Yeah. One final question. Yeah, just one.
I'm just thinking about Mark's question, and I worked in the knowledge translation team during COVID. And like getting user feedback is a big part of knowledge translation, but I can say that we skipped all of these steps and usually went straight to implement because of just how fast things were. We weren't developing apps, but like putting out resources like PDFs and digital content. But we did try to kind of gather feedback as much as we can, but at a very, very rapid scale, like 2-day turnaround or 1-day turnaround, that kind of thing. So it was just something we had to do. But I think for the future, it's really something to think about, like, how can we do this better? And then also I had a question as well, like about using like existing best practices. So there's like existing standards, existing like accessibility kind of web accessibility standards on using, how to create accessible products for users. So how does that kind of factor into the like user testing stages?
I don't think we're at the testing stage. I think Mark and Heather will probably describe a bit of that. But yes, you're right that there are standards. And these standards are very good. But the point of design thinking is to, first of all, focus on the right problems first. Obviously, you always adhere to standards and try to make sure that products are as usable as possible for people. But the best design problems are the ones that address the most important issues and problems within community, I would say. I'm looking at the designers because
I think only the other thing I would add is like to the COVID point of like things that kind of went out quickly. Things went out quickly, but there was also a long monitoring period and things were getting changed and adapted for the things that were kind of put out. So like maybe it was a rush to implementation, but I think some of the other phases came back in later when we found out things that weren't working for people, right? And then you kind of go back. So yeah.
Yeah, and the accessibility, like I think it depends on your audience. If you know you have an audience with like accessibility, with specific accessibility needs, you would sort of like surface that when you're doing your persona work maybe, and then that would become a big part of what you're building. But also like we should make things as accessible as possible. And when we're building software, we should just strive to do that. And you're right, there's like lots of great standards and guides for that.
Okay, so we're going to move now into block 2 of the activities we're planned for today. I'm going to share my screen again. Is it working? So we're going to probably skip the empathize phase. That's because I don't think we have the time to go get you to talk with communities and do some interviews or do some surveys or whatnot. We've done that bit for you, okay? But we want you to walk through the phases of the design thinking process. First, starting with defining the problem, okay? So we start by giving you a composite experience. I'm just going to state here that this problem we're trying to solve is one of the products or side products from one of the research projects I've been involved with for the last 2 years, I would say. It's on a project called Get Checked Online, which Heather and Mark will describe in a little more detail in the next session. Here, I worked with users who wanted to get tested on Get Checked Online, which offers STI tests online, but did not test for any reason. So we think of them as sort of missed opportunities because they wanted to test when they created an account, but did not test. We've sort of created a composite character, what I think eventually we will describe as personas of Didier Kone. And I will encourage you to listen to his story. Swathi, if it's possible to send or drop the file in the chat also, that'll be fine. So we've also put a script of what Didier's story is about. But
hi, my name is Didier Kone. I'm a 33-year-old French-speaking man who immigrated to Canada from Ivory Coast about 6 months ago. I am bisexual and I have...
So I'm going to pause this for now. Can you please share?
Hi,
I want you to all have notes. So we'll give you a few pieces of the sticky notes. Listening to what Didier Kone is all there. So listen to what Didier Kone is describing. Think about what he's trying to do. Think about what he's saying, the feelings he describes, and what he thinks. It's a short 2-minute story. Again, this is not, you may not catch everything, so we're sharing the script with you. I'll put it up also on the screen right there. But I just want you to listen to a story that he's told. This is sort of what you might have experienced in the empathize phase when you were doing interviews, but we've created a composite out of many experiences. Sorry. I'm just going to play this again. I hope the guys online can hear.
Hi, my name is Didier Kone. I'm a 33-year-old French-speaking man who immigrated to Canada from Ivory Coast about 6 months ago. I am bisexual and I have always wanted to maintain a sex-positive outlook on my sexual health to ensure that I and my community stay healthy. To do this, I tried to get tested for sexually transmitted infections according to testing recommendations. I had a clinic that used to help me get tested in Abidjan. Each time I needed to test for an STI, I would visit the clinic and pay out of pocket to get my testing done. I sometimes felt like the doctors and nurses would judge me for wanting to get tested, but I persisted because staying healthy is important to me. However, since I moved to Canada, it has been difficult for me to maintain my testing routine and I worried about my options. First, I do not yet understand how healthcare works in Canada. At the airport when I arrived, I was given lots of papers about healthcare, but it is just so much to get through. I tried Googling and found a few clinics in the Vancouver area to get tested. I am quite busy searching for a job, so I want something convenient. I found Get Checked Online during my online search. I felt excited because it seemed like a convenient option to get tested. I immediately created an account thinking I could get tested online. However, after filling a bunch of forms, the website showed me labs where I can go submit my specimen. I felt a little frustrated and confused. I thought this was going to be online. The website says I should take the requisition to the specific lab. Does this mean that I will pay when I get to the lab? How long will I need to wait at the lab? How will they know it is from Get Checked Online? What if I just go to another lab with the same requisition? I have so many questions. Also, given my experiences in the past at the clinic in Abidjan, I am a little worried that I will have similar problems with health workers here. How will they treat me? I tried to do some more research to answer my questions. There is an FAQ section on Get Checked Online, and I threw it to understand what to expect. But like my experience at the airport, there is just so much to read. Also, I just read that Get Checked Online offers 5 tests, but it lists others not offered. Do I need those? Why are they not?
Oh, so is that the end of the story? No, it's not.
Offered. Like I said, I want to maintain my health. I would love to know why these others are not offered. I feel overwhelmed, especially because I'm still learning to speak and understand English fluently. I am much more fluent with French, so these long documents discourage me. I would really love to talk to someone to understand what I need to do to get tested. I try to ask my friends, but they too are new to Canada and do not really know much about the service. I think I will have to settle down when I am a little less busy and try to understand the process. So I abandoned testing for now, feeling disappointed. I hopefully will get back to it soon.
Okay, so you've heard the story. I think in the chats you have the script. I'll put the script up also on the screen here for everyone. And Swati, if you can share. I would encourage you in the room to work in groups of 4. So everyone on each line, if that's okay. There's an empathy map template. We just want you to think about what you've heard, and you can take a look again at the script. I'll put it up on the screen. Just a sec. Let's see if I can get it to this screen. For those online, we're going to share.
It's in the chat.
Yes, so we've shared to get through this piece, at least just your notes, and then I can describe what we do with those notes, okay? To clarify, this is what's called an empathy map. It's building of the empathize phase and helping you generate some sense of empathy around what the user is experiencing. And that's why you talk about their thoughts and their feelings. It's really trying to get at what they're going through as they go stepwise through the process of getting to their goals. Okay. So we will just allow you another 2 minutes. I know that we've had lots of interesting conversations. If you've written lots of stuff, that's good, whether it's directly on paper or on the Post-it notes. Usually we'll take the Post-it note and then go think about ways to clearly outline it. We don't have the time, so I'll show you what the process might look like next. But just 2 more minutes. Do people feel comfortable with what they've done so far? Yeah. Do you understand DDA a little more now that you've gone through this process? Okay, great. So maybe 2 more minutes and then we'll wrap up on this specific piece.
Or twice a week.
Okay, can you help me stop this for now? 1 second. Okay, so for those online, thank you for sharing. I can see very thoughtful descriptions of DDA's experiences. If we can all come together now, I just want to give a brief interlude and then we'll get back to the activity. So don't leave where you're sitting. Okay, so I think, yeah. So maybe 1 clap, is that the tool? 1 clap will get everyone's attention.
It says if you hear me clap once.
Yeah.
If you hear me clap twice.
Yeah.
You can keep going until everybody's clapping.
Oh, I see.
A lot of claps.
Right. Okay, so you've gone through the process of creating an empathy map. Now, the cool thing about design thinking is that there's no one way to do it. As you've gone through the empathy map, as an experienced designer, I'm sure the others can back me up on this. You sort of start to have a clear idea of where the problems are, where the key issues are as you draw that out. My process and the process I was taught was to then sort of pull these pieces into some form of journey map so that you can clearly tell where the breaks are, where the negative emotions are based on what people are doing at each phase of their journey. So a journey map, and if I can share my screen, let's see, is it okay to share screen, HDMI? So a journey map will look like this. I'll just quickly give a brief description of what this is, and the designers eventually will describe how they've done their own process. So a journey map helps you tell along the process of getting to whatever the person or user was hoping to accomplish, where were the breaks within the points? What were they hoping to achieve? How did they feel throughout that process? And where did it break apart? And there are different parts of the journey map. So first off, it's usually based off of a persona. A persona is a composite. It's not one person. It's usually a composite description of who your typical user is. There are different types of personas. Usually there's the primary persona, the main person you're trying to engage on your project for. There will usually be a secondary persona, someone who's also in similar a context, who you are hoping that whatever you do in this primary context will also benefit that persona. There are also many other types and descriptions of persona. I'm just keeping it really simple here. And I'm sure the designers can give you a little more description if you have questions about it. But the persona helps you get engaged in the process so that you, as a design team, you're thinking about someone when you're trying to create a solution for. It's really that sort of tool to get you really emotionally connected with the project. So we've created Didier. We've created him as an immigrant. Like I said, this is a story of actual people who have tried to get on Get Checked Online. So that's the persona. There are other pieces of the journey map. There's the scenario which paints when, where, how they were trying to get to something, and kind of bounds the problem that we are looking at. So here we're looking at Didier, who's new to Canada and wants a convenient way to test for STIs to maintain his sex-positive outlook. These were basically out of what Didier said. So I looked at the says box, just the way you had designed, or I saw many comments on the boxes online showing what Didier was saying. Didier wants a sex-positive outlook to life. Also wants a convenient way to test for STI. So you sort of create that boundary. And then what's Didier's expectation of trying to access testing services? So he wants convenient testing. He also talked a lot about being and fearing judgment. So he wants something that feels safe. He wants comprehensive testing because, like he talked about, he had concerns around, what tests were available. He wants something more comprehensive. Then you have the boxes in the middle. These boxes each box will represent a phase of the journey. Like Sol was talking about, this journey doesn't start when they get on your intervention. It actually starts a long time before, when they were thinking about their problem. What were the things that they did to try to solve that problem? Then they got on your intervention, if they are ever getting on an intervention. But it's more along just looking across the whole journey. And this is a very simplified one. You will have some that have many boxes in the middle that really break down on a very fine level what each of the processes look like. What he does is listed in numbers here. I don't know if you can see I'll bring, is there this I can bring? Yeah, so what he does is listed as numbers here. So you see first, he described Googling for a testing option, then finding Get Checked Online and looking for a description, looking out to read through its description. Then he talks about seeing that Get Checked Online is a convenient way to get tested. And that's the first phase before he moves on to then attempting to get on Get Checked Online to get tested. The final piece is around the feelings. So this line here describes across the journey, where are his feelings? The higher the line, the more excited, happy the user is. the lower the line, the less happy, the less excited the user is. So when you see this user gets really excited at phase 3 when he sees, oh, this is a convenient option for testing, starts to get through the testing process, but then it dips down into feeling overwhelmed with many questions that they had. And then you think about the phase where this happens. And then that starts to give you a sense of where you can, be interrupting that journey to make sure that their feelings remain as high as is possible, so that you're really addressing that problem by connecting to their feelings. So this is Didier's journey map. I think the next activity we just want to do, again, I flip this back and forth. Usually you might want to start off with a clear goal of a clear description of the problem. But I have flipped this around just to help you sort of transition from the empathy map into something more concrete. Again, you will see this process. I think I really like Sol's diagram about the backs and forth, because you keep moving back and forth each of the phases. So next, I just want you to think again about what Didier has said. If you can stop my share. And then on your papers, just think about what Didier has said about his goals, what he really wants to do. Clearly describe that. And then can you come up with a problem that Didier is experiencing based on the goals that he has described? So we'll share papers about that. So you can just work with the last 2 boxes. You don't need to work with the first one because we've already gone through that in the room. But online, you have Post-it notes. You can just describe what were Didier's motives, and then what is the problem Didier is experiencing. I've described the journey, so it's sort of helping you or giving you a hint so that we move through this process a little quicker. You might not have that hint in real life. But just walk through that process, describing the problem statement. The key, and why we're asking you to describe the problem statement, is that many times when we have that problem, it can then help us start thinking about potential solutions. But the key to describing a clear problem is that it should be action. It should be something that you can create an action to address. It should be clear, not vague, very clear based on the experiences that you have heard. But it should not also involve a solution. So you should not be talking about the solution here. You should just be clearly describing a problem that Didier is experiencing across his journey that he's just described to you. So what did you think were the problems that Didier faced? If you can just frame it as a problem statement, that would be great. So for those online, I want you to think back to the journey map. Remember where the journey fell apart was around transitioning to lab services. So Didier happily filled the forms online, received instructions to go submit specimen, and there Didier started having lots of questions. So think a little more about those specific pieces to think about what a clear problem is with Didier's current journey.
Well, and you can't just do it.
It's 2 hours free parking. I know, I was just like, it was just a thing.
Yeah. And you have to really.
I know, that's what I think. They have to like really get exactly the right time. Exactly.
This being active issues to tools also.
Yeah.
Understand like.
Yeah.
Like actually having sorted. Like, oh, well, yeah.
I have one question. So, yeah, I missed it. Sophie didn't know that the crazy fours were usually done individually. So she printed.
Yeah, so what she did was that you can slide.
I was gonna just cut that.
Yeah, it's fine. Yeah.
Okay, just wanted to double check.
Yeah, it's fine.
Did you have to take the whole version?
Just the door, took the door off.
Yeah. And I would ask you. So I guess like.
17?
Yeah. Plus like the $17 like. So that's so much. So. Like not his.
And the question that you have.
Like he makes this wrong. Yeah. Like usually.
It's the same here.
Yeah, but I had to take the whole thing. Just to get to it, you have to like take everything. But it's just a big metal text. It's like a drum inside.
Yeah, I understand. I understand.
So just assume
Regular testing and routine.
You have to do it.
Actually, I have noticed that there's a.
Okay, so that's exciting.
So.
Okay, so we'll try to round up now, and just quickly get to take a look at some of the problem statements that you have described, if that's okay. After this, we will take a 10-minute break to just get some relief. I think you've heard from me a lot today, so just to get your ears on breaks, and then we'll return. So first off, I'm looking at those online. I see great statements around Didier not finding the information he needs on GetChecked Online. DDA is unsure about payment for services. DDA wants to keep healthy but has a difficult time finding clinics. Are there any specific problem statements in the room? Any other persons describing what the core problem is based on the journey map I just described? Again, no right or wrong answers. I think even in practice, you spend a lot of time thinking about a problem statement, crafting it, getting feedback about the problem statement from various partners that are involved with your project. So I don't expect the most fantastic problem statement, but just wanted to hear your ideas about what the core problem is with DDA's experience so far. Anybody? Yeah, sure.
Go you.
Oh, okay, well, I'll go and then you.
Yeah, Devin, I'll fill it in.
I think we struggled with what level the problem could be defined at.
Okay.
Is it at the Get Checked Online level, or is that a step up at the whole system level?
Yeah, that's a good question. And that was one of the reasons I put up the journey map first. It looked rather counterintuitive to me as I was trying to create this whole scenario. But you're right, you have to bound the problem. You have to bound it within something. And so you're trying to concentrate here on Get Checked Online and describe the journey and where it falls apart on Get Checked Online, just to get you to think about Get Checked Online. But you're correct. That's also something to think about when you're doing problem statements. You have to think about the boundaries. When, where are the problems happening? Exactly where? Yeah, so good notes. Any other comments, questions?
So just to follow up on that, like our bigger overall would have been that like understanding and being able to access public health services within the Canadian context. So then if we move it to the Get Checked Online, it's the having language and information that's accessible to be able to understand the processes and having the ability to ask questions and feel like they're getting the feedback back that they need to feel less stressed and overwhelmed with and judged in the process in general. Yeah.
Yeah, correct. Any other comments or questions? I'm trying to share my screen. Any other? Yes.
Our teammate shared a good point as well. Like hypothetically, if all of these resources had been given to this person in French, there still could have been a lot of like higher level, broader barriers. And so I can understand how really keeping the problem statement tight is important, because then you run into that wicked problem issue that you're talking about where, okay, well then it's the whole system. And you know, like it's just too many elements to try and solve in order to really address this person's issue. So yeah, I think really tightening what can, at least for now, be addressed is important.
So while we were doing the activity, I was also doing it along with you. I gave an example, but now as I'm listening to you, there's even edits I want to make. That's just to show you how iterative this process is. So I sort of focused on who DDA represents, right? So recent immigrants wanting to test online, I would say through Get Checked Online, but yeah, setting the boundaries. Struggle with going to a laboratory to support, so submit specimen because they are unsure about the process. Do not have a convenient, succinct information source. I would add here accessible information source about the process and the number of tests available to them. This sort of gets us to where it's happening online, what's exactly the issue, issues about information and the accessibility and convenience of the information. It's not like there's no information, there's actually too much information. We need to bring it to be a lot more succinct and convenient for the DA. So thank you for your time. It's 1:25 now. At 1:35, if it's okay with you, I would ask to all come back at exactly 1:35. We will start with having a conversation around Get Checked Online. we talked about it as if it's some phantom thing, but Heather and Mark will describe Get Checked Online and the design thinking process around Get Checked Online, and then we'll get into creating some ideas around solving this problem that I have described for you. So thank you, and we'll see you in 10 minutes. Can I pause record? All right, so we're back. Thanks, everyone. I hope you've gotten some relief from my voice. You're going to hear it again for a few more minutes. So I'm going to invite Mark and Heather. Mark Bondyra is a user experience designer and has worked on Get Checked Online for quite a long time. Heather Pedersen is an online sexual health services manager at the BC Center for Disease Control. Both of them will be describing their process. So you tend to see it now come alive, the process of design thinking and how they've used it within different frameworks to address public health problems. So please just a round of applause for them because I couldn't pay them to come. Please, bigger. I'll owe them some.
Thanks. Hi, everyone. So we're going to talk about Get Checked Online, sort of how it came to be. And as we were talking, we were like, does everyone know what Get Checked Online is? I know like there's people in the room who are probably very familiar with it, but so we sort of like hastily put in a slide, but it's not here. It's in our other presentation. But maybe do you want to just give like a 10-second?
Sure. Yeah. So Get Checked Online is essentially a way that you can create an online account, make your own requisition, go to a lab to provide your samples and get your results online. So it's a public health initiative. It's a partnership between private labs, our public sector, and regional health authorities. And yeah, is that good enough?
Yeah, I think that's great. So I'm going to talk about the process of sort of how Get Checked Online came to be, and I'm going to look at it through the lens of this design thinking process, and sort of looking at this diagram that we're familiar with these 6 stages. And I should say, like, when Get Checked Online started, it started before I was even involved, and we weren't like this, we're going to use design thinking methodology to like make this happen. But our focus was always like very user centric, and we definitely tried to use a lot of the methodology, like to be iterative and to prototype things and to do like user testing and focus groups. So while we didn't initially maybe start out saying like this is going to be a design thinking project, I think we definitely did come to operate in that way. So sort of thinking about this first phase. So I'm trying to just give you a quick glimpse of like what we did and a little bit who was involved. So this was kind of before the Get Checked Online project start, but the BC Center for Disease Control was doing a lot of things. There was a nursing team doing cyber outreach with youth, and they were going on like cruising sites and like other sites where people had questions about like sexual health and things like that, and they were answering questions. They were talking to clients directly through chats and through emails and other things. They were answering questions on online forums. And I think this is like, you know, the empathize step. It's like it's starting to get to know like what questions people have, what their concerns are, like who these people are and kind of like where they are in their lives and what kind of opportunities there were. And then there were some other external drivers, I think. So there was an operational call for proposals that sort of like, I think, got the ball rolling with Get Checked Online. There was inspiration from a program in San Francisco that was doing an online testing program. You know, then there was a needs analysis around increasing rates in youth and MSM. And there were other gaps and barriers that were identified in existing testing services. And sort of this is like where the idea for having an online program came out of. And so then we sort of started engaging more. This is kind of where I came on board. And we sort of started thinking about like, what would this look like? I think we were really lucky. We had a lot of expertise in terms of the clinicians at the BC CDC about like who our potential users were, because of that prior work that they had done, and also because of our clinic and other things. So we sort of started thinking about, like, we ran some persona workshops, and I know we talked a little bit about personas. There's different ways to build personas, but one of them is, like, you can sort of run persona workshops, and sort of use the expertise in the room to try and build some of these composite people. So that was what we did. And you can see, like, the process is very much like we're putting things on sticky notes, we're drawing on whiteboards, and then eventually we sort of develop some personas. And a big part of this, I think there were some questions around, like, what happens when you have, like, multiple personas, or, like, and the thing is, we sort of had, like, this is just like a partial, so you just see 3 of them, but I think we had 9 different personas that we came up with collectively as a group, and several groups, because we involved a lot of people in this process. And part of that persona creation process was also, like, the prioritization process. So, like, is one type of user more important to us? Which is not to say we're ever going to, like, ignore the needs of other users, but sometimes, you know, when we're designing things, there are trade-offs. So this is at this defined stage, we're doing persona workshops. We're also looking a lot at our clinical processes, and we're thinking about how this could integrate into our existing clinical processes. Because a lot of the challenge is, like, how do we get people to give their specimens, right? And the solution we came to was working with life labs, but so people go to life labs to give their specimens. But, you know, the challenge is, how does all that integrate into our existing systems and, like, our existing clinical systems? And then we started doing focus groups with the general public to sort of talk about, like, was this even something that was acceptable to people? Were they interested in it? And how did they sort of imagine it would look? You know, even this was like a long time ago. So it was like people weren't really as technologically savvy. And then we see it, like, doing usability testing now versus doing usability testing. Was this like 10 years ago, Devin? Am I like, yeah, this was like 10 years ago.
No,
it was more than 10 years ago.
It would be
This is 14 years ago, which either sounds like a really long time to you or it doesn't, depending on how old you are. But people were not as technologically savvy back then, right? Like, imagine sort of like middle-aged people, like, doing stuff online. Like, now everybody does it, right? Like, my parents are shopping online, it's fine, but it was a different time back then. So sort of just assessing, like, will people be interested in using these? Like, will people be interested in having their sexual health information on the internet? So a lot of that, we did a lot of focus groups to sort of, and to understand what people's concerns were about that. And then we get into this ideation phase. We spent a lot of time working on this diagram, which is just thinking about, like, what is the process going to be? And we sort of, you know, a lot of the design thinking thing is, it values, like, I can't remember, there was a slide you guys had about this, but I didn't see it. But it values, like, action over, like, sort of thinking too much. It's like, it's better to prototype something and show it to people and get feedback. So we were always, like, we started with a very rough version of this. We were showing it to people. I think we showed some of this in our focus groups as well, but definitely, like, we were showing it to different clinicians and other people who we would be working with, and just kind of refining this just to get an idea of, like, what could this thing look like. And we started thinking about, like, some user stories. So, you know, a user story just describes what a user does. So it would be like Didier would be like, as somebody who wants to get tested, I would go on Get Checked Online and I would create an account. That would be, like, one user story. And then, of course, we know for him that didn't work out because, you know, we weren't supporting him in the right ways. But then we sort of also get into wireframe sketches. And we sort of started with some even rougher wireframes than this, but now we're starting to look at, like, what does the software actually look like? So what will people be seeing on their screens? And here, so we get into this, like, ideating phase, this prototyping phase, and this testing phase. There really is a lot of overlap and back and forth in this, because, like, you know, when you're creating wireframes, you really are, like, prototyping, but you're also sort of, like, you have ideas, you're trying them out in your prototypes and you're seeing if they work, and you're showing them to people. So sort of the more formal prototyping stage, like, we had the wireframe prototypes. We also spent a lot of time thinking about just content, like, what information do people need? Like, people have lots of questions. Is this private? Is this safe? And then eventually we developed sort of like some higher fidelity mockups. So, you know, on the left, you see like, that's a wireframe of what the homepage might look like. And we're really thinking about things like information architecture. So like, what are the different sections? We're starting to think about like labels, like what are things called? Although you can see a lot of that text on there is fake, but we took this and we did usability testing on it. So we made a clickable prototype that we sat people down in front of a computer, like members of the public and also our clinic clients. And we had them go through this and we told them what it was. We were like, and imagine you wanted to use this to create an account and get tested. What would you do? And then we observed them as they did it. And when we did that, like we're really looking for places where people stumble, where they get into trouble, where they're not sure about something, like where something doesn't make sense. And we use that to sort of iterate through and make changes to this. And eventually, you know, we did a whole branding exercise and this was our initial design for the homepage. And if you go to Get Checked Online today, you'll kind of see like the bones are still the same, like the headers but kind of the part in the middle has changed a little bit. But I think like the key thing here is, you know, I put some arrows going back and forth, but there's actually a lot more arrows that went back and forth here. But the idea is like, yeah, we really wanted to start with like a very basic prototype that captured the experience, test that out with people, use that to sort of further define that, eventually like develop some higher fidelity mockups. I think on here we did 2 rounds of usability testing, but when Sol was talking about like paper prototyping, I had this memory of like, I think we actually did a little bit of paper prototyping. So there might even be another 3rd round here that I forgot about. It was 14 years ago. And at some point we also did more focus groups where we were like showing people a more sort of finalized version of the website. And again, always trying to get that feedback. And the last phase was like implementation. And this is like, we had kind of arrived at a model. We had done a lot of work with Life Labs to figure out how this was going to work. And now we turned all of that we had like mock-ups of what it was going to look like. We turned that into software requirements. Then we had to get someone to build it. So we went through a whole RFP process to select a vendor. The vendor built it. And eventually we launched it into the world. But I think like, this was like a very long, the size of these is not representative of how long they took, because definitely different things take different amounts of time. And some of these activities are also like occurring concurrently. And I should say there's like a whole layer here. We used to call it like the Get Checked Online onion, but there's at least like 2 other layers here, which is kind of like the service design part of it, where like it's like, what happens at the clinic? What are the procedures? How do we get test results from Life Labs? How do we enter them into the system? How do people like get their test results? What happens if there's a positive result? Like we were working on all this other stuff too, besides just sort of figuring out the software piece of it. And then, you know, we were working with like, where are the servers for this going to be? Like we spent so much time talking to like PHSA IMITs and like privacy and security. And like, I mean, Devin's just like nodding over there. She spent so much time like getting this through like all those bureaucratic channels. There's like at least 2 other layers. But that's kind of how, and then we launched it. And this is kind of what this is what Get Checked Online looks like today. The piece that I haven't shown you actually is on the right-hand side. That's like the website that the staff use to look up clients and enter test results. We were also like developing that and doing usability testing with like clerks and clinicians to make sure that it was like usable for them, because they're using this like every day. Yeah, and it's really continued to evolve since launch. So we added self-collected swabs. That line sort of shows the number of tests. Yeah, test episodes. But you can see like we've made a lot of changes over the years. We expanded out of Vancouver to the island and interior. We made a responsive design, so now it works on mobile, which was huge. And the majority of our users now are on mobile. We created a mobile lab form so people didn't have to have to print out lab forms. Expanded to Fraser, and we recently also did some updates to how we sort of think about gender in Get Checked Online that Heather's going to talk a little bit more about. But I don't know if anyone has any questions. Or we can.
Is it like the best job you ever worked on?
Yeah, you know, it was the
With the
best
best
job I
boss.
ever worked on. I mean, I have to say, I sort of came from more of a private sector world, and I had done some projects in healthcare, but kind of on like the vendor side. It's really nice to work with people in health because they're very engaged. They're like, yeah, it's easy to sell people on the idea of like, this needs to be user-centered because there is like that care for patients.
Online again.
I just had a question. So in terms of, first you did the persona exercise, and then when you actually got into the user testing and working with people in real life, did you kind of try to recruit people from those personas, and how many people, like how did that work?
We really did. And
Yeah.
I have to say, like, recruitment for usability testing is like, it's hard. And we recruited two ways. We recruited our clinic clients. So I think on the intake form, maybe we asked people if they were interested. And then we sort of sent out an email and we recruited that way. And we tried to find a pool of people that were different ages and like sort of, because we wanted some people who were like very tech savvy, some people who were like less tech savvy. And that was like an okay proxy for that. And then the other group of people that we recruited was like random strangers off the internet, which is like, we put ads on Craigslist and we said, we'll pay you, I can't remember how much it was, but like, we'll pay you $40 to come and talk to us for an hour. And this is kind of like, so we did that. And we got a variety of people. I think though, the important thing about usability testing is like, you can actually learn a lot from a limited sample size. So even like 8 people to like 12 people, if you show them something, like you're going to find like, I don't know what the statistic is, but it's like, you'll find 80% of things that are wrong with with like what you're building. And I think that's very true. I mean, we did more than just that. We kind of did multiple rounds of it, but recruitment can be challenging, especially if you're looking for people who are like very representative of your personas. I think we struggled more because we did usability testing for gender. And I think there we struggled a little bit more to find. I mean, we found lots of great people, but we didn't find, I think, as many as we
Well, I think we'll get more into it when we talk more about the gender changes. I think with that one, we did so much back and forth with designs and prototypes that by the time it got to the usability testing, we had a pretty good idea of how it was going to work. And so it was actually pretty quick for that. But I'm thinking about cervix check and the usability testing, right, where we did recruit more people. And I think we kind of recruited until we were seeing a lot of repetition in what we were hearing from people. Yeah. And then kind of closing it off then for that one.
But I would always advocate for do like usability testing early, even if you're just showing people like, even if it's like pieces of paper with printouts of your screens, because you're going to like learn a lot.
Rick?
So you got a graph that's going up over years, looks great. If we were to graph like missed opportunity, people like DDA, would it be inverse or would it be similar?
It's a good question. I mean, I think part of what's going on, I think we have not yet seen a peak in Get Checked Online utilization. I don't think we will, and especially because we're continuing to try to expand. But in terms of who we're missing, I think COVID really jump-started a lot of technology solutions that weren't really possible until then. And so I've definitely noticed since COVID, just it's feeling a lot louder, the expectations that people have. And I don't know if that's just like, if that's things that were always there, or if it's just now that digital is so much more common that it's coming out more. Devin, I don't know if you have anything you want to add, that you'd add to that.
When you say missed opportunities, do you mean like DDA where they actually signed up and then didn't go forward?
Yeah.
I would, we don't have that information, but I would actually say it probably would parallel that, because the more people you see that are actually engaging with the system, the more it's likely to not meet everybody's needs.
I think too, like the early days, I mean, what's not here is that, and so first I'll say that I've only been involved in the program for 5 years, so I'm really piggybacking on the knowledge of Devin and Mark and Mark and others. The Get Checked Online was kind of targeted more towards GBMSM and youth gay and bisexual men who have sex with men and youth in the early days. And the promotion really reflected that. And we've seen, again, I've kind of noticed, especially after COVID, but it was happening before that, that now it's just as convenient testing options in general are, as health services are becoming more constrained in general, I think we're seeing more people looking to a service like Get Checked Online. I don't know, and because we also did that analysis around COVID and utilization and stuff like that, we saw similar.
For utilization, definitely COVID had a role in use. On the question around missed opportunities, what we have are just snapshots at this time. We don't have more longitudinal data to understand that. Like everyone said, probably will mirror that same line because the Get Checked Online can't necessarily meet everyone's needs. And as the pool for users expands, especially with COVID, so more racialized users, more bisexual, gay. So you do find that as a more diverse experience on the surface, there's potential to not serve all people. That's where the work of continuing to quality improve the data serves the idea of design thinking, trying to adapt the service for as many diverse users as possible.
Okay. So I'm going to kind of jump into a bit more about how we use design thinking and a design thinking approach to adaptations and improvements that we make to Get Checked Online from a health equity lens. So like I said, I've only been involved in the program for 5 years. So part of it is I wanted to kind of use an example since I've been involved in the program, although I have distinct memories of Mark and I used to share an office before I was working in this program, and I would have distinct memories of you being like, do you like this color or this color? Do you like this one or this one? So I've been a Get Checked Online fangirl for a long time, but yeah, so you know, I wanted to use the example and also just kind of grounding some of these principles in health equity. So spending a bit more time talking about the empathize phase, empathize and define and ideate phases as well. And so, yeah, so this is an example from how we kind of a couple of years ago when we changed how we use gendered information in Get Checked Online. So in terms of how we empathize or understand our users, we use a few approaches. So the DISHI research team, so we led by Mark Gilbert as well, and our BCCDC operations group have always been really closely connected and embedded. The research team has been exploring factors related to the design, development, adaptation, implementation, and use of Get Checked Online since its inception. And we also rely heavily on collaboration and input from our community partners and users. And some of our key learnings are that evaluation and program improvement need to be iterative and ongoing. And I think that's really reflected in some of the design thinking pieces that we've been talking about today. So we consult often with different people and in different ways and find that having pathways for feedback and being responsive to users not only supports program improvement, but it also builds trust and also kind of when you talk about engaging users in some of these different steps in the process, it really helps to have partners, community partners and trusted partners to help with some of those recruitment pieces and that sort of thing. And I think this is critical, particularly when trying to reach and build relationships with underserved communities, while also working within the constraints and structures of our healthcare systems. And really this is also how some of the adaptations that we undertake and emerge get prioritized. So in this particular change that we made, it started with the knowledge that trans, two-spirit, and gender diverse people disproportionately face barriers to sexual health services, and that not all healthcare services and settings are, queer-friendly or safe for folks. And so to someone who's had negative experiences with health services, an online on-demand testing service like Get Checked Online could be really appealing. And because you don't need to be registered, I didn't mention this before, but you don't need to be registered with the BC Medical Services Plan or use your real information to use Get Checked Online if you want to. It could be an appealing option for someone with limited options or who's hesitant to engage in healthcare. And so our objectives for this work were to understand gender-based experiences to sexual services, to change how we collect gendered information, and to make it more clear to people how their information is used. And ultimately, we're aiming to improve acceptability, appropriateness, and uptake of Get Checked Online among trans, two-spirit, or gender diverse people. And so here I'm just kind of, when we talk about those boundaries around the problem, this is just kind of a snapshot of some of the stages in the Get Checked Online process where gender is used or comes up. And this is, sorry, apologies, this seems a little bit nonlinear, but because there was a lot of back and forth between the different kind of like phases, but not surprisingly, we heard that not surprisingly, we heard about the many negative experiences that folks have had with the healthcare services or providers. And when it comes to gender data collection and utilization, folks were generally supportive of sharing information that's needed for their clinical care, but they needed to be asked the right question in the right way. Clinical services often offer no explanation about the data they're collecting. And when it came to gender data fields, we often heard, why does this matter? So this, combined with general mistrust or past negative experiences, resulted in a reluctance to report gender on clinical forms. And this is not limited to Get Checked Online. This was, what we were hearing about healthcare services in general. Limited options that weren't reflective of multiple or diverse identities definitely came up, but we also discussed how terms and language is always evolving. So really it was less about getting the right list of terms included and more about signals that kind of help folks see themselves in the service, such as allowing multiple options and text. So to help with our understanding of practices and preferences around gender data collection, we started with a literature review, followed by community consultations. So we held interviews with 5 organizations that serve trans and gender diverse communities to ask them about how they collect this data and why, and to get their thoughts on Get Checked Online's approach. We also directly partnered with trans individuals and organizations for this work. So we worked with Trans Focus Consulting, who worked with us at every stage of the process, but also collaborated with Transcare BC. And once we had kind of a proposed direction, we had multiple rounds of internal review and discussion with our clinical leads and team. We also had to do the mapping across the health information systems that Mark described before, and consulted with different community advisory boards at different stages of the design and review. And so after a few rounds of working and reworking our approach, we held focus groups. And lastly, we conducted usability testing on a prototype to test the application changes. So, and then, I think, do you want to, I think I can just, so just to show you what some of the kind of prototypes and things looked like for this particular change, I think maybe less, it's less interesting, I guess, because it is kind of still text-based, but really we kind of went into this with an open mind of like, we kind of had an open of like how the questions would be asked and how they'd be offered, and then kind of moved it into a prototype. But I don't know if there's anything you want to add to that.
Yeah, I mean, the changes that we're making are like, in a way, they're very small, but they're like very meaningful. So we spent a lot of time on a lot of very like detailed, if you go to the next slide, like, it's like these all kind of maybe look the same, but they're all a little bit different. And so like we spent a lot of time thinking about like how we sort of present these options and how we let people choose. And
and so then in terms of the usability testing, so again, like we kind of said before, we actually only ended up doing the usability testing with, I think, about 8 or 10 people, I think, that were recruited just through personal networks, but also some of the people that had volunteered to participate in focus groups, but weren't able to make it for whatever reason. But yeah. And I think by this point, we were seeing a lot of repetition. I think because we spent so much time workshopping different ideas and prototypes and things, yeah, we found a lot of repetition, what we were seeing by this phase.
Yeah. And to do the usability testing, we built basically a mobile prototype that we did all the usability testing online with people. So we met up with them in like a Zoom session, and then we had them open up the prototype on their phone and go through it, and sort of they talked us through what they were doing and what they were seeing, and that's kind of how we conducted the usability testing for this.
So yeah, for implementation, we kind of have some, yeah, I don't know if you want to talk about some of the software.
Yeah, once we sort of arrived at that final point where we were like, we think this is what it's going to look like. We had to sort of finalize those mock-ups, write software requirements. We have a vendor that does our development for us. So they developed the new functionality. We did like a ton of testing, and then we released it.
And I would be remiss without mentioning the many, many, many people involved, or I guess these aren't people, but the many groups that are involved in Get Checked Online that have made this program what it is today. So yeah.
We just one question. Oh, I see. We'll take this one. I can't choose. Okay. Maybe we'll start with you.
I just was wondering, through your examination of like the terms and what other providers were using in terms of their gender or their forms, did it change within, like because you're working with Life Labs, did they also adapt some of their form language?
I think what we wanted to do, because we have a high amount of control within Get Checked Online, our goal was like to be how can we be the most user-centric through Get Checked Online, and then make it work within the structure of the system. And so there is some like, so for example, in the gender indicators that Life Labs has, it's just MF and U, like or other, right?
Unknown,
right? Unknown, right? Yeah, MF unknown. And so even though we have different, the way we ended up asking the question is like, having a select all that apply option for gender for our program reasons, but then just asking people outright, what do you want on your lab form? And then that way people it's kind of a two-part question. And so again, it's part of that, like going in with an open mind. And I was actually through one of the interviews that we did it was actually Sarah Chown who made this recommendation. I remember in one of the interviews that we did, who's now the executive director for Ribbon Society, but just said, ask people outright, what do they want in there, right? And it was like, oh, never thought of that, of just saying, what do you want on your lab form? Because we can do that. And so I think, it's part of why this IDA phase of just going in and saying, okay, let's think big. And how we ask about sexual activity now, it's very anatomy based, because that's what we heard from trans and gender diverse people, where it's just like, what body parts do you have and where do they go? And that's how we'd prefer to be asked, other than, another way. And so, yeah, it was just responding to community and making it work within the system.
Yeah, my question is, and I mean, I'm troubling this constantly in my job. And also, I guess, as a queer person and a parent of a trans kid who are white-bodied and hold a lot of privilege within those communities, I was just curious if, and all these beautiful ways you engaged with community, was there any considerations for intersectionality, recognizing that, like, my experience, for example, would be potentially very, very different from someone who also experiences racialization and other things like that?
Yeah, I mean, I think it's something, it's like working, it's why I think part of my big interest now in my role is like learning more about who we're missing, and then how can we do better? Because I think you're never going to meet everyone's needs, especially through an online service. But And even just within these gender changes, like even what we ended up going forward with, it wasn't like everyone's preference, right? Like it was just, like that's just always how it's going to be. But yeah, I think it goes back to that continuous program improvement cycle that it's just, we never think of it as done. It's all, we're just continuing on to the next program improvement cycle. I don't know if I talked around your question or if I answered
I think
it.
that makes sense. And I guess it's also, and things we've said probably myself.
Yeah.
Like, when we're not able to please everyone, who are we actually focusing on?
Yeah.
In terms of who experiences to be more violent. Because of,
Yeah.
and that kind of thing. Like, what are the actual consequences of going with maybe the majority of those who've been engaged, even though they might not be the most.
Yeah. Yeah, no, it's a good point. And I think it's like part of the persona piece is like you have to have your primary personas and like who are we most interested in. So yeah, I think in this particular change, we had kind of the transgender diverse folks, and it maybe didn't have as much of an intersectional lens, but I can say in the next kind of round of improvement, we are prioritizing personas around kind of immigrant or migrant folks or sex workers or things like that. And so it's just different change. So then different round of personas and different adaptations that we'll make based on that. Yeah.
So much.
Thank you so much. Thank you. Round of applause. Okay, so we're going to go back to the original problem we had created. Let's see if I can find my slides. Yep. So we've had conversations now about how we can use design thinking to promote ideas around equity. And that's the core of public health, figuring out what works for different people to ensure that they have the best chances of securing good health and good health outcomes. But we have DDA still to deal with. At this time, we had created a problem statement. I should have edited it slightly to include the statement around accessibility. So DDA or recent immigrants wanting to test online struggle to go to a laboratory to submit specimen because they're unsure about the process, do not have a convenient and succinct information source about the process and the number of tests available to them. So Swati is going around with papers of what we call the crazy, ideally this task is called the Crazy Eights. The Crazy Eights is a tool that helps to ideate. What the focus is really not trying to overthink your solutions, but just to get some solutions on paper at the time, right? And so if everyone can please note this problem, for those online, I'll pop it into the chat also. The problem, again, is wanting to test but not having succinct information sources about the problem, about the process, and not having a clear understanding of what the number of tests available to them are. So they are looking for succinct information. That's essentially the problem. In front of you, you have 4 boxes with 4 Post-it notes. You have about 1 minute for each box. Your task is just to think of a solution, put it in there. Don't think too much. Just how can we solve the problem of creating very succinct information for people? And for those online, I will go share the whiteboard where you will have also a similar template. You can take your Post-it notes online and then post it into the boxes. What you're creating is a solution for this problem. How can we get DDA succinct, accessible information on GetChecked Online to ensure that all of his questions are answered very quickly? Again, don't think too much. Don't question yourself, just write. What solutions do you think about? So, yeah, for those online, the timer is set and I'll put it up. So you should see a timer starting now. Just put something in there up top. So let's start with the first box. At the end of 1 minute, I'll reset the clock and we'll start again. Just write an idea. If your ideas are great, we might steal them. Thank you. Yeah. No, but just random ideas, anything that comes to you. How can we get DDA information that's succinct, clear, accessible, and able to help answer all the questions he wants in a very straight to the point manner? If you don't have any ideas, also totally fine. You can leave the boxes unchecked. Again, low pressure, low stakes. Okay, I'll stop and then I'll restart it. So you should be moving to the next box now.
Another idea.
Yes, another idea. Just work off another idea. Is it pressure? So yeah, I can imagine this feels like a lot of pressure, but the way Crazy 8 is done is just to get you moving. And I think that theme has been sort of reiterated in the conversations we've had. Design thinking is about a tilt towards action. In public health and public health research especially, we like to focus on the problems and take a long time. But this is a way to move towards action. Okay, I'm going to restart again. So you should be going to the third activity now, the third box. Okay, and then the final one. Again, this is a truncated process. It's you have the opportunity to do a lot more in actual projects that you probably engage with. Okay, so we're done. Thank you, and that was a lot of pressure. I hope you're feeling good. For those on, sorry, can I stop the noise from this? For those who wrote on the specific papers and not on Post-its, it's fine if you can tear that into small pieces. Swati is passing around now for each group a bunch of boxes. For those online, I will just move us. I'll zoom out a bit and show us these boxes. These boxes are sort of helping us to organize the thoughts and ideas we have into major boxes or major categories of ideas that we can then start to think about working on. This is called an affinity map. Here, we just take off the ideas that we've had now and look at what the similarities between these ideas are and just combine the ones that are similar into a box and give it a name. You can also think about the different categories you have and see whether there's any relationships between the different categories, right? So again, I'll encourage you guys to work as groups. I'll work with the guys online if that's okay. We'll just try to separate the ideas into small boxes. And these can then become things that we think about implementing as prototypes. So starting with low fidelity into high fidelity prototypes. Okay. So online, you can just work with me. We can try to put things together that seem similar. If you have thoughts and ideas, you can also put it in the chat. I'm able to see that. Just okay. So translation. So we're going. Feel free to unmute yourselves and just speak if there's anyone. Any takers? Okay. Well, I can try to speak on their behalf. But please, someone stop me before I get through this. It would be nice for you to speak to your work. So we have sort of 6 main groups of ideas that we've looked at online. The first one is an FAQ section. So just quick answers about things you need to know, or a sort of things you need to know box. But then there's visual instructions. So a video showing the process, visual instructions with minimal, simple languages. There are backend solutions actually. So creating an API that links everything from Get Checked Online to the lab. And then there's additional platform functionality. So things like a 24-hour chatbot, which would be really cool. Embedding a source translate tool that can help to solve some of the aspects around language barriers. And then search optimization online. And then finally, having or improving the Life Lab experience, which is, again, something we can try to discuss within design thinking processes about defining the boundaries of your project. Do you have control over specific things? It would be nice to influence the Life Lab experience. The question is, do we have the control over that? And you have to be thinking about that within your organizational constraints. But we voted online, I think, and the winner is visual instruction. So creating videos that are engaging. And then the next most voted option was FAQs. And finally, the chatbots solutions. Yeah. Does anyone in the room have any additions? You can just tell us what you did in your group and what your priorities are. Maybe we'll start with the first group. Anyone? If there's no one, it's fine.
Yeah, sure. I mean, we had a lot of the same things. I think the one that we decided on prioritizing would actually be the 24-hour type of chatbot or virtual assistant. Because with some of the other things, if you submit a question that like gets sent somewhere and then answered later, you might walk away from it and not come back to it. So with the virtual assistant, it kind of gives you like that immediate answer to your questions. And there could also be like a translational aspect to it. You might be able to ask, like, can I get services in French or any other language?
Cool. So we're thinking about the large language model there. Okay. Any other person? Next group, sorry.
Oh,
yes. Yeah.
We didn't get a chance to vote.
Oh.
We were organizing by theme, but we had FAQs, like in a rough sense, FAQs within application translation, a call line or a helpline or health link, BC, chatbots, just more instructions on the Life Labs experience, and then navigators within the community.
That's cool.
Yeah, so can like you link up with former users or community partners who can help people navigate the process? Like, could there be a portion of that website where people can find that connection to help them guide them through? But I think the facts, the FAQ / translation piece was like the main thing that we looked at. How can we have people get the information they need in the languages that they can understand? And so is that a button that they can click on a page that translates it for them? Or is it just being able to download the forms or the information or see a video in multiple languages? How can we get them that information that they can understand?
Yeah. So two things I want to emphasize about your idea around that is how even within digital context, you can still think about non-digital solutions. So I really like the idea of a pair navigator. I think, for our persona who's a recent immigrant, we're going to be thinking about a pair navigator or pair navigators integrated within immigration services or community services that are targeted at immigrants, recent immigrants, and thinking about how that can help people then access the service online. So sometimes the solution is not always on the internet or on the digital side of things. It can also be, supporting services that are linked to that digital service. So fantastic ideas. I think we are down to one group.
Yeah, I think we had all those. Most of all those ideas of ours have been covered, including the pure navigation.
Yeah.
Except maybe the accessibility services modalities. I think.
One specific, we also didn't get a chance to vote, but one specific thing is like embedding widgets into the site, like Google Translate, right? Which isn't perfect by any stretch, but means that people aren't having to navigate between different websites, and that at least, given that we serve populations who speak hundreds of different languages, there's probably some main ones we could just translate for, but it's a way, again, to just remove one of the friction points people face when they're navigating a website.
Is that possible, Mark? Like just have a hover Google Translate button somewhere?
I think so.
That's cool.
Like
Not super high quality.
Yeah, we recognize that. The
And then you'd
translation
link
is not
through,
great.
and then you'd link through to also more supports kind of thing, right? But
But as an immediate way of like, if I'm going to a website and I don't know, I just did this with booking some travel. It's like better than nothing.
Yeah.
And it is better now than it used to be too, I will say.
And it gets better by the moment.
It does,
Like literally, AI is learning us. So.
As everyone was working, Mark and I were chatting, and I was saying, one of the things that we're doing for Get Checked Online starting this summer is going through all of our content and really focusing on accessible and plain language, because I think there's ways that you phrase things that translate well and work better with Google Translate and others that don't. And so even by making that small change, you can potentially improve things for with tools that maybe aren't necessarily embedded within Get Checked Online, but that, some of those translation tools and stuff.
we had talked about other accessibility tools too, I think, right? And then this thing, sex positive environment.
Oh. Yeah, I think we're just trying to think like, I don't know, a really great paper just came out recently on, knowledge and information versus like the broader behavioral context where people make decisions. And I think we're thinking of, is there like ways to nudge the context that someone would go on and think this is a sex positive environment? Like, what would it look like? What would it feel like? Both in the digital space, but also in the physical space. And obviously it's like part of the human space as well, right? We need to make sure people are saying things that feel sex positive, but can we start with environments that we have some control over? I don't know what that looks like. I feel like you'd have to ask someone.
You're not going to solve that for us today?
No. Sorry, really. I don't even.
No, it's just a question. So it's a question about the process.
Okay. I'll just take one final comment. An additional suggestion is a multi-language chatbot. So just along the lines of chatbot, just fantastic ideas actually. Like I said, we might steal some. Okay, Aurelia, your question?
Yeah, two practical questions about the process, because I'm paying attention to how you're facilitating the process and trying to get some like ideas about how it works. So one, like was the crazy for intentional in limiting the time that you could brainstorm solutions to? And then if you could speak a little more too about that, because I'm thinking this brings you back to the previous session where we were discussing about, digital health promotion, potentially, the default being downstream digital health promotion rather than upstream digital health promotion. And so I'm thinking a lot of it has to do with the problem, how the problem gets defined. But when you have a limited amount of time, I'm thinking that maybe the solutions that we brainstorm might tend to be more like downstream, like very tangible, concrete, but that which is good because then you're already in the prototyping lens, but then maybe a little bit not like, super like nuanced or more kind of like upstream oriented. Does that make sense?
Yeah. I think it does. I'll try to answer as much as I can, and then I'll look to the rest of the guys who spoke with me to fill in the gaps. So about the process, this was crazy 4s. Ideally, it's crazy 8, so 8 ideas. You're given a short amount of time because the evidence suggests that when you're given a lot of time, you get stuck in the minutiae and then stuck in thinking about the solution rather than just giving a solution out there. So it's, again, leaning towards action, just leaning towards hastening that process, knowing that you still have opportunities to clarify and iterate. So again, this is an iterative process. Many times when you have your initial set of ideas, you then bunch them into groups, let's say in a workshop, we take those home, you go sit with it and think very clearly about it. Like, what are the implications of doing this in this way? Are there refinements we can make to the general idea? So we maybe not look at the individual ideas in the whole box, but we look at the whole group, like the themes now. So we have visual instructions. Okay, so that's a potential solution. How do we do this in a way that is meaningful to people? And we can do that by, first off, really thinking about the problem statement. So I want to go back there to address your second question around downstream, thinking about health promotion first off. So in this session, we sort of, again, I said, I wasn't anticipating that we'll make designers out of folks in 3 hours. So it was a very rapid process, right? But when you think about the problem statement, I've known of processes where the problem statement takes months to come to a final decision about what the real problem is and how it's phrased. Mm-hmm. So that's also another iterative process where you can then be figuring out how you create a problem statement that directs attention towards more upstream issues as compared to downstream issues. So carefully crafting that problem statement will help direct people's minds and attention towards what potential solutions you can be making. Deliberately, I sort of highlighted the idea of succinct information source somewhere. So it was already deliberately addressing or pushing you towards an answer. And it's not strange to me that everybody came up with around 5-6 grid boxes of solutions. That's because the problem statement was geared towards directing you that way. So the key piece is around focusing a lot of attention on making sure your problem statement really reflects the experiences of the communities and the people you are trying to help address their problems in a way that's meaningful. And then from there, the ideas can flow.
And so the other one, tangible or practical question, is around the second part of the step. So once we have like the crazy 4s, and then you have the theming and prioritization. And then that one, you asked us to combine or categorize into 6 potential things. Is that number intentional, or do you leave it open-ended for people to come up with as few or as many themes as they want? Or does he have an intention in terms of helping the teams prioritize later, or is that?
So
Could it be open to any number of themes?
my experience is limited. I'll probably deflect again. I know that recommendations are to have between 5 to 9 broad themes. I have seen templates that don't have any real boxes and people just try to sort through things as naturally as possible. But the recommendation is to have between 5 to 9 because you want to have something that's manageable to then vote on or prioritize. If you have say 20 themes, it's difficult to then create sort of a priority list out of 20 as compared to 5. That was the general idea.
Thank you.
Yeah. Any other questions or comments? Sorry. From the guys here? Okay. So I think that brings us to the end of this section. Can you help me end this? Thank you. Right. So this was the template we worked on. So yeah, we've done this piece. Okay. So the question will be, so we have candidate ideas, what next? I think we've already sort of described it. You move quickly into the prototyping phase and then usability testing and so on and so forth. I just want to first of all thank everyone for taking the time to join us today. This was fun for me. I hope it was just as fun for you. Now I'm feeling like I should go take more courses on design and, and have conversations with you guys. But I think one of the points we're trying to make here is around how design thinking can be a framework that is broadly applied to public health problems in a way that promotes equity. The idea that you focus on the needs of people, diverse communities, and continuously iterate towards solutions that are, connected to them and empower them to actually reflect the changes they want to see within the health system. So this is a framework that you can think about in any section of public health that you currently exist in. I have maybe 1 more minute for any random question, comments about the whole process. Okay, so there's none online. Is there any comments or questions I'm missing? Okay, I think not. Okay, so what's next for us? First of all, I want to thank everyone that came. Thank you to the speakers. Thank you for spending time prepping the sessions with us. This was great. We will share with you slides of all that we've done. So if you want to look through, we'll also share with you a resource list. It's not long, but the resources themselves are quite rich. They're just, toolboxes, toolkits that give you a number of tools that you can use in the various phases of design thinking. There's also courses that you can take. Some are paid, some are not paid, depending on your interest, whether you want to dig a little further into the idea of design thinking. So I'll encourage you to take a look at that when we do share it. The final session of thankfully this series is coming to an end. Well, thankfully and sadly at the same time. But the final session will be on July the 10th. We'll be having a team that has worked with machine learning methods in public health, specifically public health research. They'll be sharing with you ideas and experiences they've had with implementing these frameworks and these tools within public health. So again, when you do get the notices, if you're interested, we'll be glad to have you again. And you can share to your friends also who are interested in machine learning for public health. Yes.
Projects that could use a UX designer, would any of you have recommendations or be able to connect us with someone who's done that type of work?
I'm looking at the designers, I don't.
You can't take Mark.
Yeah, I think, I don't know. There's some challenges with finding people sometimes within the.
Are you talking about to actually hire on staff?
For a specific project, if we wanted to connect with a UX designer to either consult or actually work on the project.
Yeah, I mean, within PHSA, I would recommend like writing up a statement of work and sending it out to the preferred vendors list and just be really specific that you actually want someone with UX experience. That's how I found Mark. Actually, I just recently saw that I believe that there is now a job description for a UX designer within PHSA. There wasn't before. And I had actually went through multiple layers of multiple processes to try and get one, but wasn't successful. But yeah, I would say probably like contracting, getting someone on as a consultant is your best bet.
Okay, thank you.
Yeah, and there's also like SFU has a big like UX master's program. So depending on like kind of like, but there are sort of students too that are looking for projects.
Yeah.
So that's another possibility. And there's an organization called VanUE, which is like the Vancouver User Experience Group.
Okay.
That has like designers in it of all abilities and at all different stages of their career. These are options.
You can also check with Emily Carr, because I think they have a design thinking as well, and then UBC does.
UBC, so I'm actually a product of the Designing for People Create cluster. That's how I also got to meet Sol. So right now the program is defunct, but the members of the program are still available, and you can actually go on their website, DFP Create. I want to say .ubc.ca, but I might be wrong. But yeah, so there's the DFP Create program. So there's also a group of design researchers who are also very available to do this.
Okay, great, thank you.
Probably what you did is reaching out to professors and then they can point you towards students.
Because there are lots of students constantly actually looking for projects to work on who have the theoretical skills, but needing some more practice-based environments to put some of these things to practice. Yeah. Okay. The final thing, if you guys would do me this favor, just let us know how we did. Did this suck? This suck partly? Was this okay? Just let us know. We'll try to learn from it and get better. Go easy on us, please. But yes, if there's no other thing, thank you for coming. Thank you for spending 3 hours of your time with us. I really appreciate this.
And thank you for organizing.